Welcome to Indian Union News. Our guest today is Dr. Om Ganda, one of the leading experts on diabetes.
So diabetes is a progressive disease. It starts off with a slight rise in blood sugar level that gradually then increases to the full-blown diabetes. And early diagnosis is really critical. The most important thing about diabetes is it can cause a lot of long-term complications over time. Some of these complications affect the eyes and vision loss down the line. The second type of what's called microvascular complication is the effect on the kidneys. And the third major complication is neuropathy. Neuropathy can affect the feet, but can also affect internal organs, the so-called autonomic neuropathy that can lead to drop in the blood pressure when somebody stands up, sexual dysfunction, and things like that. Then there are these other major cardiovascular complications under the general rubric of cardiovascular, which includes heart attacks, chronic angina, strokes, and also peripheral vascular disease, in other words, circulation problems in the lower extremities. So these are some of the major complications. And people with diabetes are 2 to 3-fold at greater risk of developing these long-term complications of heart, kidney, and blood vessels than people without diabetes. Another reason to think about diabetes management early and preventing complications in the long term. Get a hemoglobin A1C test, which is an average blood sugar of 2 months average blood sugar level. But if you go in the morning in the fasting state, you can also get a fasting blood sugar. So one way to kill two birds with one stone is appear in the doctor's office for fasting blood test, fasting blood sugar, and hemoglobin A1C. And there are all kinds of numbers that we look into, and some of these tell us that there is somebody with pre-diabetes, and the certain numbers, for example, if the fasting blood sugar level is less than 100, that is normal. If it is 100 to 125, that is pre-diabetes. And if it is 126 or greater, then already you know that somebody has diabetes. A simpler way might be if someone cannot go in the fasting state to just get a hemoglobin A1C test done, which is an average of last 2 months blood sugar levels. So you don't have to be fasting for that. And the normal number is anything less than 5.7. 5.7 to 6.4 is pre-diabetes, and 6.5 and higher is diabetes. So oftentimes people present for a general physical exam not having seen a doctor for a long time, and they are surprised to see that the hemoglobin A1C is 7.5, 8%, or even higher, because it's a silent disease. So if you don't go for regular checkups, you can often be surprised to see that you had diabetes and you didn't know about it.
Okay. Now if you can talk about the prevention by food and exercise.
Right. So preventing diabetes is the key. We know that diabetes and prediabetes are very common. So 2 simple things we learned from national studies that we did, funded by the NIH, called the Diabetes Prevention Program. One was watch your weight. And to do that, you have to reduce your total caloric intake by about 250 to 300 calories a day. That's what we did in a number of people who already had prediabetes. The second part is do something which is very practical, 30 minutes of walking 5 days a week. And when we did that study, we found that people who had prediabetes, when they reduced their dietary intake by 250 to 300 calories a day and walk 30 minutes 5 days a week, they can reduce the progression from prediabetes to diabetes by 58%, a whopping 58%. How many people are following that advice? Very few. Unfortunately, it's very difficult to get people to understand this and to be motivated. They understand this, but the motivation is the key problem. So diet and exercise can have major impact on prevention of prediabetes to progressing to diabetes.
If you can also talk about these the medicines all the time being advertised on the television.
So there's been an explosion of interest, and there are a lot of new medications available to treat diabetes. So in the past 6 to 8 years, we now have very solid evidence that somebody comes to you for treatment in the physician's office. There are two questions you need to ask first. Number one, do you have any cardiovascular disease, heart disease, or history of stroke? A lot of people do, and they already are aware of that, but they did not know that they had diabetes until they get admitted in a hospital. The second question you ask is what kind of treatment you have already been taking. You might have heard that there's a very common drug called metformin. For people who cannot be controlled with diet and exercise, they take this pill called metformin. But now, by asking these two questions, we are actually giving them advantage of two of the major drug classes that were recently discovered and put into practice by clinical trials. So these two classes of drugs, one is called GLP-1 receptor agonist. It's easy to take. Used to be twice a day injection, then once a day injection. Now they're available as weekly injection. One little injection given by a little pen-like syringe, and you're done once a week. And if you have history of coronary artery disease, such as heart disease or stroke, cardiovascular disease in particular, as it is known as, then you can actually prevent the progression of those events. Or actually, you can keep the appearance of those events by taking these specific drugs to treat diabetes. So not only do they reduce blood glucose level, but they also reduce the risk of cardiovascular disease by an entirely different mechanism, part of which is controlling blood sugar. The second question is about the drugs that are particularly useful in preventing the kidney disease from appearing or progressing, particularly if you have evidence of very early kidney disease. And these drugs are called SGLT2 inhibitors. There are 3 of them on the market. So what happens, this is a simple pill to take. And clinical trials have shown that these drugs in the SGLT2 inhibitor category, if used in the early stages of kidney disease, it prevents the progression of kidney disease, ultimately requiring dialysis or even transplantation, a major breakthrough that has happened in the past 10 years. And I think this is really why we ask these questions first in managing people who have diabetes. And these drugs are effective regardless of whether you are on metformin or other drugs in the past that we used to use, or regardless of what your hemoglobin A1C is, in other words, how well or poorly controlled you are, and regardless of what other drugs you're taking. So this is actually a major breakthrough. If you don't have these complications already present, then of course we'll treat a person with diabetes with any of the multiple drugs that we have at our disposal, which include metformin, other oral agents, and if needed, insulin, people who cannot be controlled with just the pills or these weekly injections that I was talking about. So a lot of new stuff and a lot of breakthroughs in preventing the complications of diabetes.